Hello, welcome to Health Authority TV. I am Janan Sarwar. I'm the deputy editor for Health Authority Books, an imprint and partnership between Indie Books International and Global Bookshelves International. I'm really honored today because I get to introduce you to Dr. Carmen Frede. She is a nurse practitioner, a TBI, traumatic brain injury, survivor and advocate, and many more things. So I'll let her introduce herself. Thank you so much for coming today, Dr. Carmen.
Thank you for having me. Yeah, many more things. Mountain bike rider, um, recent author, and yes, huge TBI advocate, both in and out of clinical practice. Um, Definitely have shared this experience as the survivor, so helping people navigate both in and out of the hospital. So I work in rehab medicine, which is dealing with a lot of complex spinal cord injuries, stroke, brain injuries, long COVID, anything that you can really think of that affects the function. Uh, but in my off duties, I mountain bike and a huge advocate at getting patients, especially survivors of concussion, return to their baseline activities, whether it's mountain biking, is that something that I really enjoy. So I'm a huge advocate in that avenue.
That's amazing. And we were talking before this, and you yourself, you're both a rider of bikes and a writer with your
Yes.
with your recent book, which is fascinating. Why don't you tell everyone about the book you just wrote?
It's more of a memoir example for anybody to kind of navigate. I know that the healthcare system is very overwhelming. There is so many areas that we can improve, and trust me, we all in it wish that we could fix it, but unfortunately, it's a very broken system. So I want people to find their voice. Unfortunately, I didn't find mine quick enough. So that's what prompted me to write the book, as maybe this would help somebody else, as I needed this book when I was navigating my recovery, and it's just something to kind of make the healthcare system less overwhelming.
Absolutely. I mean, anyone who knows anyone or has experienced a traumatic brain injury, you had to completely rebuild your life, right? And just tell me a little bit more about what it means to you to be, I know you're a survivor, but what is it when you advocate? What is advocating for TBI? What does that mean for you?
So kind of like what you said, it is, you know, re getting to know yourself. You feel like a totally different person.
Yeah.
You do have a sense of loss of self. You lose friends. You kind of, in a way, lose some function. Where I used to have a photographic memory, and that was that's how I survived college. And then
Yeah.
afterwards, it went away. So I had to learn different strategies. One of them auditory and reading things out loud, as silly as that sounds, but that's how I was able to write my graduate dissertation to finish my doctorate. But it is having that experience incentivized me in a way, or empowered me to change a broken system, because at the time I was a nurse trying to navigate it with no instructions. And it was just enlightening to realize, if I can't navigate this system with my own concussion as a nurse, how are my patients navigating this without a healthcare background? So that is where I felt like I had to at least do something. Um, Even if it didn't even make a difference at a larger scale, I figured even a small scale, I can help out as many people as I can, so they don't feel like they're lost or on an island all by themselves.
That is incredible. And the work that you do on a daily basis, you're specializing in brain injury patients in some form or another. And beyond that, with the work that you do, what other work that you do? I know you do a lot of volunteering and a lot of awareness raising. Can you tell us more about the services and things that you're doing with the community?
A lot of things are improving access to trails, like mountain bike trails, walking trails for families, um, even for individuals with disabilities. That's something that we are having an open discussion about. Because if you think about it, you're sharing a space, and a lot of people don't have a lot of room to share that space, especially if you're an adaptive survivor with like a spinal cord injury and you need different equipment to be on the trail. So we're trying to help make outdoor areas, especially parks, more enjoyable. We're also trying to make it a little bit more of a discussion topic of it can happen to anyone at any time. So even if you don't have a brain injury, there's certain tools that you can have on hand where, like if you're hit by a car on a bike, I have like a card that I made for individuals just to kind of follow a checklist so they can be like, okay, I need to call this person and this person just to keep them straightforward. Or if they are disoriented, ask for help. Um, that's one of the things that I'm a huge advocate for is safety awareness or injury prevention.
Yeah.
Uh, the other thing is not medical, but huge animal advocate.
Oh,
I volunteer at a rescue organization and love to rescue the animals that nobody wants because they're a little bit more difficult. So I
yeah.
kind of feel like I understand them in a way, and we work on rehabbing them to get them to be more um, adoptable. Sometimes it happens faster than others, but that is the other thing that I like to do.
That's amazing. I love what you're doing for the community at large, not just the TBI community in general, but so many people can benefit from this and the awareness that you're bringing. So thank you. Thank you for doing that. Thank you for your work. And I love that you wrote the book and a book for people. When can people buy your book and what's it called? Tell us a little more, if you don't mind.
So the book is called Wired Differently. It's navigating a brain, kind of your life back after a brain injury. It is kind of my story in a way, but the tools that are in there are the tools that I developed while I was in recovery that I figured I would share them with individuals because I'm finding that this is a huge barrier of there isn't anything out there to help individuals navigate or at least help them in a way, you know, de demystify the healthcare system and make it more of a less of a challenge of communication.
Speaking of that, you just answered my big question of what is it if you could change and redesign the healthcare system? Even if you're repeating what you've already told me, just tell me what is your dream vision of what a good healthcare system could look like?
So the healthcare system is very complex. Unfortunately, there's a lot of barriers.
Yeah,
Um, we definitely need to bridge the barriers, the gaps. We need more real world needs in the communities, um, especially for our aging population.
right,
Uh, so basically, I would want to just go beyond the standard. I would want to like open up a forum of discussion with patients. I want to keep it as like a team approach. Like you're on a team. This is a shared goal. So basically shifting the entire system from a reactionary to proactive.
right.
Uh, that's the other thing that I really want to allow for conversations instead of checklists. I want to actually integrate that, not everybody is the same. We all have different opinions, different viewpoints of the world. We all, there's different cultures, and all of those affect health. There's different religions, and it's not saying that we all need to, you know, pretend that it's, going to go away. We need to include that as part of our treatment because that is a whole piece of how somebody gets better. It's helps with the mental, it helps with the social, it helps with the physical. Uh, Main things of we basically have a series of disconnected appointments, and it's not not what I would expect the world to be right now with our healthcare system.
Totally get it. I understand. I love the vision. I believe in your vision, and I think what you're doing and what you're advocating for can help a lot of people. And I hope if anyone listening knows someone with the TBI or has suffered from or experienced one themselves or a survivor, you will see yourself and maybe you can relate to a lot of the tools and resources in Wired differently. Thank you. Thanks for coming. And is there any
Yeah.
way, if someone wanted to reach out to you and connect with you, what's the best way if they wanted to connect?
Yeah. My email basically is the best way.
We'll include
And
it at the
yes, I
bottom.
was gonna say you can more than welcome to include it.
Yeah,
Um, I love questions. I very much tell my patients I love them to research. I want everyone to feel comfortable when asking about healthcare services or even community healthcare. It's something that we all need to open up a forum to talk about.
absolutely. Absolutely. Thank you. Thank you for your time today. I really appreciate it. And for everyone listening, until next time, may you be healthy, wealthy, and wise. See you next time.
Right.
Bye.